in there. Okay. Hi, everybody. Good afternoon. It's great to see everybody. Thank you so much for joining us. I'm Jennifer Rosenberg. I'm one of the associate deans here in the UB School of Pharmacy and Pharmaceutical Sciences. I'm here with Rebecca Brierly, who is our assistant dean for external affairs. We are here with 3 of our graduates and a number of our colleagues. We are so excited to have you with us today. We are super excited to have planned this webinar for you. We actually can't wait to get started. What I'm going to do is I'm going to share my screen and jump right out into our PowerPoint. And we're going to get right into it. So hold on one second. Okay. Okay, assuming you can all see this correctly. So our webinar this afternoon is Alumni Conversations, where you get your degree matters. So again, welcome and thank you for taking the time to join us. We're really excited to spend an hour with you this afternoon. So just quick housekeeping, welcome. Please mute your microphone. We're gonna do chat Q&A at the very end. So we will have ample time to answer any questions that you have. Our panelists will have time to answer questions. And then if there's other housekeeping items, we can do that at the end. If you're disconnected, please rejoin. It happens, it's Zoom. Sometimes we get disconnected. Don't panic, please just come back. And if you have any technical issues, just send us a note. I want to show you a short video, and then we're just going to do a couple of quick slides and introduce our panelists. Okay, so just some quick housekeeping about the School of Pharmacy and Pharmaceutical Sciences. While you're here, if you didn't know, we are the #1 school of pharmacy in New York State and number 14th in the United States, as ranked by US News and World Report. We are 14th out of over nearly 150 pharmacy schools. So really in the top amongst some very, very good schools. We are really privileged and pleased to be ranked number 14. It's a testament to our faculty, our staff, our students, and our alumni. So again, we're very, very pleased. We also have a top 30 AACP research ranking. Our panelists are going to talk about their research as well. We are a leader in the education of pharmacists and pharmaceutical scientists for over 130 years. We are not a new school. But as our dean says, just because we've been around a while, it doesn't mean we do things the same old way. We are a highly innovative school. We are poised for change. And I think this year has shown us that being poised to change is probably one of the most important ways to be. We have world-renowned programs in pharmaceutical sciences, and we're going to talk with you about those today. And we are accredited by the American Council for Pharmaceutical Education. In addition, we have our academic health center. It's one of my favorite things to talk with you about. I will highlight it briefly. It will likely come up as our panelists talk with you today. We're certainly happy to answer any questions. We have 16 distinctive degree programs. In addition, we are an excellent value as a public institution in New York State. One of the key benefits is that we are a small school, believe it or not. So we have like a building. Our School of Pharmacy, between 500 and 600 students. We have pharmacy practice, PharmD students, and then we have students in our PhD, MS, BS programs in pharmaceutical sciences. We have some dual programs. We have combined programs. Again, we have between 500 and 600 students in our building. within the context of a major public AAU R1 research institution, over 30,000 students. So we have that really nice balance between having our own school, where we have the sort of the combination of having the large public research university and all the resources and benefits right at our fingertips. We have a wonderful location in Buffalo. It's a wonderful place to live and go to school. It's affordable, great quality of life, high standard of living. So it's just a lot of fun and very welcoming. So it's a great place to be. We're excited to kind of get back to life here. The Academic Health Center, I can't leave without talking about it. It's my favorite thing. It is probably one of the key strengths of the School of Pharmacy and Pharmaceutical Sciences, and certainly the University of Buffalo. Very few institutions across the United States are members. And basically what that means is universities that have sort of the comprehensive mix of having a medical school, dental school, public health, nursing, social work, and pharmacy, and only 40 of these have a school of pharmacy together with this mix. This means so many things for prospective students and current students, and even our graduates, where students get to work together as members of healthcare teams. We are nationally commended for our interprofessional education, where you really work together and learn how to be a member of a healthcare team, no matter what setting that you work in. So again, an important and exciting takeaway, certainly exciting for us and our faculty. So I'm going to hand it over to meet our alumni panelists. That's why you're here today. I'm going to hand it over to Becky Barley, who's going to introduce our panelists.
Welcome, everyone. It's my pleasure to be able to start introducing our panelists so we can begin our panel questions shortly. To begin with, I'd like to introduce you to Dr. Vanessa Gonzalez Covarrubias. She is a PhD graduate from UB in pharmaceutical sciences, and she graduated in 2008. Her thesis was in the pharmacogenomics, pointing to ethnic differences in the metabolism of anthracyclines and genetic variation. After graduation, she took an opportunity as a postdoc at the University of Leiden in the Netherlands to study aging and lipodomics. In 2013, she joined the National Institute for Genomic Medicine in Mexico City, where she leads the pharmacogenetics lab. Her team investigates the role of genetic variants in a diversity of clinical outcomes, including response to hypertension and antidiabetic drugs, dyslipidemia, and aging. She also teaches pharmacogenetics at the National Autonomous University of Mexico. She lives with her husband, who is also a UB graduate, and her 2 children in Mexico City. Welcome, Dr. Gonzalez Covarrubias.
Thank you. Thank you. A pleasure to be here.
And our next panelist is Dr. Francina Monteiro. Dr. Monteiro graduated from the University of Buffalo School of Pharmacy and Pharmaceutical Sciences last year in 2020 with her doctorate in pharmacy. Upon entering the PharmD program, she was part of the Early Assurance Program and was an active student leader while in school. She is currently completing a 2-year postdoctoral fellowship in Novartis in conjunction with the Rutgers University. As a student, she always had an interest in specialty therapeutic areas, as well as an interest for project-based work, which guided her to her fellowship in medical affairs with the U.S. Oncology Scientific Communications team at Novartis. In addition to her responsibilities at her company, she also participates in teaching opportunities as part of the collaboration between the Rutgers Institute for Pharmaceutical Industry Fellowship Program and the Ernest Mario School of Pharmacy faculty. Welcome, Dr. Monteiro.
Thanks, Becky. It's great to be here.
And next is Dr. Alex Shepard. Dr. Shepard is currently a senior medical director in the Rare Disease Division at Pfizer Incorporated, where he works to enhance the diagnosis and management of patients with rare cardiovascular disease, transthyretin amyloid cardiomyopathy. Alex earned a bachelor's degree in biology from the State University of New York at Geneseo and graduated from the University of Buffalo's combined PharmD MBA program in 2014. As adjunct faculty here at the school, he completed a 2-year postdoctoral pharmaceutical industry fellowship at the Rutgers Ernest Mario School of Pharmacy in partnership with Pfizer Consumer Healthcare. He remains heavily involved in the fellowship program as both a preceptor and a member of Pfizer's fellowship leadership team. Alex started his career as a senior medical manager in Pfizer's Consumer Healthcare division and is now the medical lead of a prescription to over-the-counter switch clinical and behavioral program, which is a data-driven, highly regulated process of transferring prescription drugs to non-prescription over-the-counter status. Outside of the pharmaceutical industry, he has been a practicing retail pharmacist, an educator at several pharmacy schools, a passionate student advocate and a mentor, and an amateur podcaster. And he does occasionally sleep at night, I think, with all of his other responsibilities and duties. Alex lives in New Jersey with his wife and 2 young sons and spends his little time in the outdoors hiking, fishing, kayaking, and mountain biking. Welcome to Dr. Shepard.
Thanks for having me. I'm looking forward to the conversation.
Okay,
And we are now
good.
going to, go ahead, Jen.
Go ahead. Nope, you go ahead.
Good, okay. We're now going to begin the question component of our program. So I would like to first, we welcomed our alumni panelists. I'm so glad you're here. You can tell us more about why getting your degree matters and why UB is the best choice for a great educational experience and the best path to an even greater career. As advised by Dr. Rosenberg earlier, attendees can use the chat feature towards the end of the program to ask the panelists questions. If your question is for a particular panelist, please indicate that in the chat so I can make sure that I direct that to them after we are finished with our questions. So panelists, we're going to begin. And my first question is, and this can be answered by all 3 of you. We'll kind of see how the cadence of the questioning goes. So we'll just kind of start and see where it goes from there. First question, why did you pick the University at Buffalo? And was it because of the reputation of our faculty, the reputation of our programs? Was it because of our chicken wings? Or maybe other academic or gastronomical opportunities? If you could comment on both the academic and our great food, that would be wonderful. I'll let whoever wants to start, just go ahead and raise your hand and I'll let you go. Alex?
I'll go. I'm happy to answer. Well, I'm from Buffalo. I've been in New Jersey now since 2014. I'm going to start with the gastronomical because I miss Buffalo food. Everyone talks about the food in New Jersey and New York, and there's good food in New York, don't get me wrong. And I've traveled and eaten good food around the US, and I can tell you that the food in Buffalo is incredible. I miss most of it. From an academic perspective, I know I'll share why I picked Buffalo back in 2008, partially because it was home. It's a benefit. Every decision has some cost, some benefit. And when you choose an education, some of it is true financial cost. And I think that the education for the cost of Buffalo was the right ratio for me. That, and I know I was always interested in research. And interestingly enough, one thing that I didn't do enough of when I was at Buffalo was research with faculty. And at some point I'll share a story during here of one of the interviews I went through where I was asked about what research I may have done with some of the faculty, because there's some world-renowned faculty at Buffalo. But the curriculum and the I guess the standing within the rankings in the US for University of Buffalo School of Pharmacy was attractive to me. And again, that kind of takes into account the cost of exploring other universities and the benefit you get from an education at Buffalo. In my opinion, it's unparalleled.
I could go next. I think I have to echo a lot of what Alex was saying. The food is amazing. I've only been out of Buffalo for a year, but I'm already trying to plan a trip just to go eat in Buffalo. And I think the cost and the value, when I had to do a ratio of that and see how would it be beneficial for me, I think that was one of the factors I took into account as well. And I think out of the other thing, now that I moved out of Buffalo, the rent factor, the cost factor to live in Buffalo, the cost of living is a lot more affordable compared to any of my other schools that I had looked at. And now that I'm paying like New Jersey, New York rent, I really do appreciate the value of cost of living in Buffalo and for what I got. And when I applied, this was back in 2013, I think I was also looking for schools that kind of had like an early assurance program or a direct program, which is one of the attractive factors of this program. I happened to do that, and I was able to bypass the exam the PCAT exam that you had to take. So that was one of the factors I looked at. And I think when I looked at the rankings it was about like Buffalo was top 20 and now it's actually risen in ranking and it's top 15. So I did want to go to one of the best schools in the country, and this was right in the same state I lived in. So I think those were the reasons I picked Buffalo.
I hear Alex and Francina's answers, and it sounds like homey, and it feels comfy. For me, it was just totally the opposite. I was working in Mexico City. I was working at a time probably at I worked for Procter and Gamble for a few years, and for me, going to the States was a very far away place, and I didn't want to make that decision alone. So I had a couple of acceptance letters, and I had friends and family going through the UB website and checking out the program. And we agreed after a lot of talking that UB had a very reputable and competitive program. Plus at the time, because I am a 2008 graduate, so that was like 5 years before that, you do the math. The UB website was beautiful ever since. It was probably early at the time, but the website provided so much information. I was able to do all my registration online, file for my English degree. Well, not the degree, but the English as an extra and additional language. So yeah, it had a lot of support online, and it also was a great competitive program. For me, it was also very important that the university was big enough to have a life on campus, because I was not going to be able to go back home every 3 months, or sometimes not every holiday. So it was very important for me that it was big. It had libraries. It had books. It has the Domino's pizza at the time. It had Burger King. I mean, I could have a life inside the university without feeling so far away from home. So for me, it was like all these different factors that led me to choose UB.
Thank you. Before I move to the next question, any of the panelists have anything to add to their comments?
No,
Alex?
I'm really struck by, so we all had 3 different paths. Francina came in through early assurance. I came in, I had a degree, I had worked for a year, and then I started pharmacy school, and Vanessa was working when she pursued her PhD. And what we looked for was all very different. And it makes, I can say that just reflecting on our answers, the pathway to this kind of our careers and our journeys, we came from different paths, and yet we all intersected at UB. And I can tell you, I evaluated over 20 universities during my in my evaluation for graduate school. I mean, I went to 16 jewelers for my wife's engagement ring. So if it tells you a little bit about how I think, I used to show up with a notebook of color, cut, clarity, all those factors. So, but Vanessa, it's really interesting to hear how you evaluated it. And for Francina, it was ranking. And so for me, ranking was really important. I'm from Buffalo, but to know that you have a top 20 school for pharmacy, and we went to different components of it, the pharmacy versus pharmaceutical sciences, but a top 20 school in my backyard was a no-brainer for me. But it's interesting all the different ways you can cut it and understand what's available and what's going to be your life for your formative years of graduate school.
Definitely. I have to agree with Alex. I mean, for me, it was a no-brainer either. I come from the biggest university in probably Latin America with around 500,000 students, and is the top 1 university in whole Latin America. So the reputation of UB, I have to share with you, maybe I wasn't highlighting it enough, but yeah, it had to be a good school to keep studying, right?
Yeah, and it's similar in the business program with the combined degree. We had a very prominent international component, and I can tell you that that's been really helpful for me because I worked with people from all over the world. Someone that you're put into clusters in business school, and someone I worked with for a year straight was just learning English. and had a really strong finance background and was really effective when you all knew how to work together. And we all had to learn. I don't know a single, I learned a few words in Mandarin, but I know very little, but we had to learn how to work together from all over, unique backgrounds, unique skill sets. But you do have these experiences with the international community. For me, it was in the combined with the business school, but the experience I had with the international community when I came into a global role, it was really helpful for understanding culturally how to work with people when there's a language barrier, when there's cultural differences, recognizing what's important to some and not to others. And I feel really fortunate to have had that opportunity.
And I'm just going to do a follow-up based on the first question as well. And I'm going to ask Vanessa this question first. As far as the faculty in the programs, I know that when you were doing your searching as a PhD student, there's oftentimes elevated opportunities that you're looking for. When you were doing your search, if you could comment a little bit perhaps on what drew you to the programs, maybe from the faculty or programmatic component.
I knew, maybe it's too specific what I thought I wanted to do. So the program is heavily oriented towards pharmacokinetics and pharmacodynamics. So I knew just by word, of course, Dr. Jusko, who I believe now is the chair, but at that time it was Dr. Fong, the chair. He, a bright scientist. Everybody has an award of some kind, either from the pharmaceutical industry or from some state institution. And I knew I wanted to do pharmacokinetics. And then I arrived there, and the whole world gets bigger, because the school is well known for pharmacokinetics and pharmacodynamics, but then you arrive there and you see all these faculty like Dr. Morris and Dr. Blanco, and they do beyond PK/PD, what we call it, and modeling. They do genomics, and they do biochemistry, and they do cardiovascular disease. So yeah, it was a broader world than I expected.
Thank you. Francina, I'm going to ask you the same question too, as far as faculty or programmatic information. If there was anything that in particular struck you when you were doing your search?
So for me, I guess like my perspective is different because I did undergrad there. I would try to pick up just to be a research assistant or something in a lab, because I did look for opportunities as undergrad, just because I was trying to really figure out what I wanted to do in pharmacy. And even as an undergrad student, I think it was a sophomore or junior, the faculty was really receptive to someone reaching out and looking for opportunities. I believe when Dr. Rao was there, I did work in her lab for some time. So I think Vanessa's right in the sense that you have an idea of what you think you want to pursue and what you intend. But I think when I actually got to pharmacy school and kind of just saw the amount of opportunities, it was almost endless. It was almost I didn't know which one to pick. I didn't know the opportunities that were even there because of how connected UB. If you graduate from UB, UB is very well known for PK/PD. I have colleagues even in the industry that work in PK/PD, and they see UB on a resume and they're like, oh, so you're well versed in that, and it's mind blowing. So I think just the opportunities, I knew going into pharmacy school that when I got there that I would have a lot of options and even things I might potentially want to pursue.
Thanks. Alex, anything you wanted to add kind of to that more specific question?
Well, you asked about faculty, and I had an interview back in 2014 where it was for a fellowship in PK/PD. And the first thing they said was, yeah, and you can see Vanessa laughing, it's world renowned. And it was at a mid-sized biopharmaceutical company. And they started asking me about, have I gotten to work with Dr. Jusko, Dr. Major? It's like I said, I'm remiss to say that I did not take advantage of the research opportunities because I do enjoy research. I was a dual degree student, so I didn't have a lot of time. I decided you kind of have to choose what you're interested in. And when you're pursuing a master's in business at night, you don't have a lot of time to always pursue the research opportunities, but they are they're truly endless. And before this, I wrote down a number of professors whose names have come up since, and I have a list of 6 or 7 here, just from the work I've done. You know, Dr. Shentag is he has inventions all over the place, and he at one point he reached out to me about something that he was working on, and it's just to have the conversations and the connections and the history of a university with 120 years, 120 plus years. It's wild. Your roots really do run deep.
Thank you. For our next question, it's going to be, I'm going to start with it to Francina and Alex. And if you could share some memories from your P1 year in school. So as you're thinking back in this like moment right now, when you think about being a P1, and for Alex, maybe thinking back a little bit further, but what comes to mind as far as opportunities, what you felt like, and what it felt like maybe starting P1 and then when you ended P1. And Vanessa, I'm going to ask you a similar question for your program as well. So Francina, if you want to start with that.
Yeah, I could start. I was trying to think back to this question. Just, you know, it was like, it was so fresh. I was so excited to finally start pharmacy school because I knew graduating high school that I wanted to pursue pharmacy. So I think I was just like, my goal when starting pharmacy school was just kind of like exploring what everything, you know, things that I've gotten mentorship throughout my school years and careers. And one big piece of advice I've always gotten is like, don't be close to an opportunity just because you have certain assumptions about it. So I think that's like the mindset I went into school thinking that, you know, even if I'm like maybe not good at this or something curriculum wise, it's probably hard for me to just explore the idea of like, I want to try this and I want to do this. So I think I came into pharmacy school super open, very open to trying to explore all the ideas and things I wanted to do. Right off the bat, I think I got involved in extracurriculars, got involved in like the school level organizations, which kind of opened up opportunities for me on the state level and potentially some national conferences too. So I think my biggest piece of advice is like really get involved, kind of utilize what the school has to offer. And then also kind of just finding that balance of like school, I wanted an internship and then I wanted to do extracurriculars. I wanted to be a well-rounded student, and I think that was very important to me, which in hindsight has helped me a lot. So I think I came in very like ready to do school.
And I came in from the workforce. I was working for a year in between undergrad and graduate school, and I can tell you I missed school. I missed being educated and taught. So I came in excited, and I can tell you I was a much better graduate student. My habits were much better than I was in undergrad. I was focused. I was interested. I had found what I wanted to do. I loved the learning process. And first year, it was really learning about how to go about learning. You know, you can memorize, you can learn processes, you can dig behind why things happen. But it was really trying to figure out the best way to go about approaching the educational process in a graduate level program and a doctorate level program. And I quickly learned that the surface memorization is not going to do you much good when you go into your rotations and your actual experiential opportunities, and really learning why. When you start asking the why, you know a drug works, now why? You look at the mechanism of action, well, why? You peel back to the phase 3 study, now why? You peel back to the phase 2, and you keep working your way back, and you kind of learn that the clinical drug development process, and that leads to how it's used in care. And it was just those initial components early on as you bounce, because you can so easily get caught up in I have a test on Thursday, I have a test on Monday, I have another one on the following Thursday, I have a didactic the next day, and you can get caught up in that. But it's a big picture game, and I can tell you, it's easier looking back than experiencing it. But it was a lot of new relationships with with students, with faculty. It was a lot of navigating professional organizations, but also reimagining how I learned. And I actually think back really fondly to it because I carry that learning process through to every new experience I have now.
Thanks. Francine, I'm going to ask you another follow-up question to the P1 year. Courses. What 2 courses you remember the most? You can say why you remember them the most, it's okay. But what courses come to mind, maybe the 2 that you remember the most?
Ooh, tough question. I don't remember what the class was exactly called, but it was like I think it was pharmacy calculations or a math-based class. So background, like I'm not, like math has always been like, there's some, like algebra was my thing, everything else was not my thing. So it took me a little more, like I had to put in a little more effort to like get the grades I did. So I remember that class relatively, most people that joined pharmacy school were pretty like good at math. So I remember in my class, I was, I had to put in a lot more work than comparatively to the rest of the class. At least my class is very smart. And I remember Dr. Ramanathan was the professor for that class. I think I've visited him like every office hour and just like trying to get help. And I still keep in touch with him. He's only taught me like that class, but he is a great professor, super helpful. I think just going to extra help, I just built that relationship with him and kind of also gotten advice because at one point I did consider getting a dual degree in like MS and like PKPD, but just kind of going for that. I think I liked that early on I was able to kind of develop that mentorship and have that relationship where I could go do that. So I think as hard as that class was, it taught me a lot just to kind of get out of my comfort zone, talk to professors, build that relationships, because I realized early on how important that can be like moving forward in your career. And I think the other class, I think it was just like the introduction to like the curriculum of pharmacy in terms of like the patient-based lab work. I think it was just so different from what I had like be done before. You finally like are trying to practice what you're studying. So I think that was like an introductory, like I enjoyed that class.
Thank you. 2 different examples, but being able to compare and contrast is useful for it. Thank you. Vanessa, now I'm going to kind of switch gears to the pharmaceutical sciences program. So if you could tell me what like the early years were like in your PhD program, and how did it feel to be, in a very rigorous program? How did you approach that? And was there, I know we talked a little bit about faculty members you wanted to work with. Who did you end up then working with throughout most of your PhD career, and what did you think about it?
Sure. Well, after listening to Francina, Jesus, for me, it's been over 10 years, but I can relate so much. On one hand, for me, having classes, math classes like advanced algebra in English was a real challenge because all my life I have been taught in Spanish. And so that was difficult. I would have headaches almost every day because of the switching of the language. So that was tough. And then Francina mentioned pharmaceutical calculations, and I was a TA for that class. And I remember working with Dr. Murli Ramanathan, and it was a great experience. I had to grade hundreds of exams every 3 weeks. So thank you for that souvenir, Francina. It was great remembering that. And yeah, the first years of the PhD program are very, very demanding. You have full-time classes, exams, projects, and then you got to take something that's called preliminary exams. And if you don't pass prelims, as we used to call them, you can't be a PhD candidate, and you are pretty much out of the department. So that's always at stake while you're taking classes. So that's a stressful part that we gotta manage somehow while taking classes, and we're rotating to different labs. So I think I rotated for 8 weeks because I loved all the projects of all the faculty members. I remember rotating with Dr. Boje, who did neurological sciences. Dr. Fong did cardiovascular disease. After taking pharmacokinetics, I decided classes with, I think it was Dr. Balthasar at the time. I decided not go for PK. It was a little too much for me, but I love Dr. Fong's, and Dr. Boje, Dr. Morris, who does a lot of metabolism. She does a lot of these cells and enzymes and molecular questions about how a drug gets metabolized and what comes out of that metabolism. That field is also very interesting. But what caught my eye at the end was Dr. Blanco's lab. About 15 years ago, he was a new faculty member. So probably I was his first PhD student, and he was establishing the pharmacogenomics lab. So I ended up loving pharmacogenomics and mixing it with a little bit of pharmacokinetics and pharmacodynamics. But the molecular part, it was just a wonderful journey that it's been a long time, but it's fresh here, it's fresh in my mind, and it's a big commitment. But when I think about it retrospectively, it does pass quickly. And what I would say is that students that are interested in the PhD program maybe shouldn't, what I saw as big mistakes for many, that they change advisors, and it took them 6, 7, sometimes 8 years to finish. So that's something you should consider when rotating too many labs, when having too many interests. At some point, you just have to choose one and go for it.
Thank you. I'm going to switch gears a little bit and ask you questions about what you're doing currently and how your UB education prepared you in your current career path. So you can give examples about, explain what you're doing now, and then how educational path helped prepare you for what you're doing. And I will go back to Vanessa and start with you then. So put you right back on the spot.
Sure. So what I do every day is, I lead the pharmacogenomics lab in the National Institute of Genomics in Mexico City. So before the pandemic, I have a family. I have to drop off kids around 7:30 in the morning, and then I'll join the lab around at the most 8:10 a.m. So every day in research is different, and it's wonderful. Sometimes I had to prep samples, extract DNA, measure some drug activity. Sometimes we got to classify patients or go to the hospital and recruit new patients. We got to visit collaborators. We used to do our own homemade kits for sample collection. And once a week I used to teach. I could say it's a you will never get bored doing research. And when I think back, because after you get a PhD, it's a rush. You rush through the next 10 years of your life, trying to show that you're worth it. And but now I can see back a little, and I can see how UB has helped me. Coming from UB, it had a great reputation. So once I was finished with my degree, I remember Dr. Fong, he was the chair at the time, and he used to say, your job is to get a PhD, your job is to get a degree, and my job as the chair is to get you your first job wherever you want it. So that was, an eye-widening statement that showed from the faculty how sure he was that UB had a great reputation, and with a degree from that school, we could go wherever we wanted. And that worked for me. I had an offer from UCSF that I had to turn down at the time because my husband did get a job in a big university in the Netherlands. But I arrived at the Netherlands in 4 weeks. I had a job myself. It was a great postdoc position. It was not tenure, but my contract ran for 5 years. So, I don't know what else I can say. Coming from Dr. Blanco's lab opened the door for me to assure a fellowship, a postdoc position at UCSF. But then the degree alone opened me doors in the Netherlands. So it's been a great tough journey, I gotta say. There's a lot of work involved, but UB is a great credential, I would say.
Thank you very much. Alex, I'll let you take the next answer. Thanks.
Yeah, so this was, can you remind me the question, actually? I want to make sure I answer it.
If you could talk a little about your current career path and how your UB education prepared you and elevated for that opportunity.
I'll start with how UB prepared me. And it really goes back to the way I answered my previous question, which was going back and learning. These are challenging doctorate programs, and understanding how to learn and reteaching myself how to learn and having others teach me how to learn. And part of that was developing the critical thinking that's required to be successful in the sciences. Again, going from rote memorization to application. And Francina mentioned your first year, you did a practical course where you're hands-on, and it's taking what you learn in the classroom and applying it to practice. And it's a lab format, but you're actually having to do it. And then you go out into working with patients in different scenarios and working with healthcare providers in different scenarios, and you've practiced it. Now you're applying it. But to me, it all comes down to the education process to develop a critical thinking skill set. And basically everything that I do in my career relies on an ability to think critically and flex into different roles, because I work in what's called medical affairs, which is an umbrella term that it can include a number of responsibilities. I'll touch on a few. So one of the things I do is I develop scientific education programs, and I train our internal teams to ensure scientific credibility and capability. I manage different education and research grants. Right now, educational grants, and actually not right. My role changed a little bit recently, so I'm not doing that, but that is a core function of what I do. So in order to do that, you have to identify the gap, either the data gap in a disease state or with a drug or whatever it may be, and create a proposal that stimulates the scientific community to submit different grant applications to fill that data gap or that educational gap. And then you have to critically analyze and determine which are going to be the most effective to fill the gap that you've identified. Another is data analysis. So for example, a phase 3 study reads out, which is from our clinical research organization. I'm part of the medical affairs organization, so I'm not actually conducting the studies, but some of the work I do may advise on the studies. But when a phase 3 study reads out, there are a number of analyses that may be critical to the healthcare community for contextualizing the data in specific populations, looking at it in different ways. And then, so part of my role would be to work with the clinical team and analyze the data. Another would be working, and I'll leave it at this, because again, medical affairs is an umbrella term and you really have your hand in every bucket. But the last one I'll touch on is working in burgeoning science. And this is something I really like. For example, I have a role in working on a machine learning algorithm that uses diagnostic codes to help identify patients who may be at risk for a rare disease. And one of the things, it's really, my education has opened the door to working with some of the most brilliant minds I could imagine. And I'm one of the peons amongst them who really, I'm there to provide what I can, but I learn so much every day. So your learning continues, but that foundational skill set, and I keep coming back to critical thinking, because that's what the education will provide. And then it's on, I feel like it's incumbent on the student to figure out how to maximize that opportunity to build out that foundational skill set that'll take you to the next level. And the learning continues. So you're not only learning that skill set, but you're also learning how to learn, because it's not the same at each step of the educational process.
Thanks, Alex. Francine, I'll ask you, of course, the same question, and especially how it prepared you to begin a fellowship. So being a new minted 2020 grad, what are your reflections on that preparation and how your education prepared you for the fellowship?
Sure. I think I have to also echo a lot of what Alex said, because I also work in medical affairs, and, you know, a lot of what he touched on, you know, I've been exposed to in my fellowship. I think it really did come back to critical thinking. So I guess just a quick background, when I applied to the fellowship, I actually didn't have any like internship in the industry or any of those experiences, or even Appies. I really had to kind of focus on what transferable skills I had and kind of like build on that to market myself for a fellowship in this position. So it really came down to like, I think I had a really good foundation in terms of like education and how I had, you know, build habits to teach myself or just do the learning, because it really, because you can, I mean, all of us I'm sure are capable of memorizing, but like you need to be able to use that information and think critically about that information, and be able to like strategize. So I think that's my 4 years in the PharmD program kind of set me up for that. I was able to, I really reflected back thinking on my rotations. I remember I did some specialty rotations in like cystic fibrosis. I think we had like maybe 2 or 3 classes in therapeutics about that. So not too much to go off of. And I think when I started the rotation, I was overwhelmed, but with, you know, doing some readings, doing some learning from what the pharmacist had showed me, I was able to pick it up pretty quickly. So I think, and I wouldn't have been able to do that if I didn't have a strong foundation in terms of like how I learned and what kind of habits I developed. And now that I work in oncology, again, most pharmacy schools will have the basic intro to oncology courses. It's not like we're taught everything about the field. So just having those capabilities to like really do the self-reflection and be able to study the self-study, that's pretty important. And I think that translates to not just a career in industry, but any career across like the pharmacy per se. And I think those habits, and then I guess the other thing I would touch upon is also kind of like soft skills. Because in the industry, we do a lot of project-based work, we collaborate with other teams. You're working with people either in global or like even in the, I work in the US market, but I've had colleagues in calls working with a global team. So just being able to talk to them, being able to sit in on a meeting and like, because sometimes I'm the youngest person in the room and it's pretty intimidating. I was like, I just graduated last year. So just kind of like being involved in school, there's extracurriculars that I did, having those opportunities to work on a state and like national level kind of gave me the confidence to say like, I have the basic skills to do this. And as Alex said, it's like, it's up to you to like maximize everything you've learned. And I think I've been able to do that successfully every day.
Thank you very much. Gave our guests a lot to think about and a lot of good opportunities to be able to evaluate. Those are the end of my kind of preformed questions. I'd now like to ask all of our attendees and guests if there's anything you'd like to add to the chat that I can relay to any of our panelists. So that is open opportunity for you. We'll be monitoring the chat. And while monitoring the chat too, I just want to be able to thank our panelists. We so appreciate the time that you've given, your insights, your introspections. These are incredibly valuable to everyone that we have attend these programs. They're incredibly valuable to people like myself and Dr. Rosenberg as well. It's always a privilege to be able to get to know our alumni better, hear about your opportunities and career paths. It helps gives us insight that we didn't have before. So I very much appreciate that. And see, I'm not seeing anything in the chat right now. So Jen, I'm going to just again, thank our panelists and kind of hand it over to you, I think, for like end of program things.
Yep. I see we have some admissions housekeeping types of questions. What we'll do is I will take admissions related questions at the end. Right now, if you have questions for our panelists related to career, what they do, this would be a good time to do that. And then I can stay on, excuse me, and answer any admissions questions. So I can do both at the same time, but now would be a great time if you have questions. We don't have tons of people. We have about 30-ish. So frankly, we see a lot of black screens with names. Why don't you show yourself and call out your question? I see one of our students, one of our new coming students is. So I want to, if you don't mind showing yourself, if you can, no pressure if you're, so hi, everybody.
Yeah, we do have a couple of questions. I'm going to kind of roll with those, and then
sure. Yeah.
From Paige Nowak to Dr. Monteiro, we have You mentioned early assurance program. Can you explain what that is?
Yes, Paige, I will drop that in the chat. While we have Alex here, do you mind answering the next question is how did coursework for your dual degrees get split up? So maybe if you could talk a little bit about your PharmD MBA, and Paige, I'll drop some information about the early assurance program in the chat, and we can get to that in just a moment. Did that work okay?
Yeah.
Great. Awesome.
Yeah, I'm happy to speak to that. That was actually something that attracted me to the program. It was kind of early on for the dual degree program. And the way that it worked is my first year, I was in the pharmacy program. Second year, I went over to the MBA program. And then the third and fourth year, it's technically 5 years. Third and fourth year before you go to rotations in your fifth, I was in the pharmacy program full time and then took business courses in the evening. So that second, and that's kind of how the MBA program is structured, in that in your first year, you're with a pod of 4 or 5 other individuals, and they try to pull international students, scientific background, individuals with career experience, individuals just starting off, and bring together a diverse group so that you kind of have to learn how to work with one another. And so that's the first year of business school. And the second year, it's a lot of more directed work. So if you want to pursue a concentration in finance, there's a number of finance courses, et cetera. And so what you do in the dual program, unless it's changed, I'll answer that then. What I did in the dual program was take business courses in the evenings. So it would be typically once or twice a week for 2 years. So you have to, I think there's 60 credits in MBA program. And my first year, I added on 1 or 2 electives so that it would take a little bit off of my evening course load, because I still had an apartment and I had rent and all that kind of stuff, and I needed to work. And I think that work experience is really important. But I said it earlier, I did have to kind of choose. I wanted to do more research, and I just didn't have any more bandwidth. But I can tell you that Francina mentioned the soft skills required for her career. I'll double down on that. Not just interacting with your colleagues, but interacting with boards of health. There's a soft skill component that's really, really important. And I do believe I don't think everyone needs an MBA. For me, my PharmD is my core degree. Everything I do is built on the skill set I derived from that experience. And I consider the MBA supplementary. I don't think everyone needs an MBA. Some people have it. Some people have that skill set. Other people have components of it, and it helps to build it. And I feel like I fall into that category of, I had some components of it, but I was always a science student. Math and science is what I did. So that MBA helped to kind of round me out. And I've seen the coursework was intense, and it was very different for someone with a scientific background, but it was not overwhelming, and it was supplementary and complementary. So if you're considering it, anyone who is considering it, I always tell them it's worth considering and determining if it's something that will help round you out as well. Unless, of course, you want to go into something like marketing and take a whole different approach to life, right? And use that critical thinking and apply it elsewhere. It's a nice thing about it. Pharmacists kind of land everywhere. Same with PhDs, from what I've seen. You land everywhere. You have your foundation. But I have a pharmacist who reached out to me from UB, who's a financial advisor now, because he used that analytical skill set to analyze trends within the market, and he has these ideas, and here's the types of industries he analyzes, and you'll see it over the years. It's a foundational skill set that applies not just to healthcare, but all over the place.
Thanks, Alex. We had another question. That's a good question. How hard is the PharmD program on a scale of 1 to 10?
I guess I could start taking that question. So I guess this might not be the answer you want to hear, but I don't think by any means it's easy. It's a graduate level, relatively, like, I think Alex mentioned this before. I didn't have the best studying habits undergrad, and I did fine. And I knew those habits wouldn't cut it for grad school. I realized that within the first week of school. So I kind of like doubled down and, tried to change those habits and be more diligent about it. It also depends on, I guess, like, what are your strong suits? So for me, like, math wasn't my strong suit, so I had to put in a little more extra work. I also chose to be pretty involved in school, so I kind of had to balance work, balance my extracurricular responsibilities, and also do school. So I had a lot on my plate, and I think trying to balance all of that and still do well was definitely challenging for me. There were days that were very hard, and I just was like, why did I pick to do pharmacy school? But then there were days I was like, this is exactly why. There were rewarding things I was able to do because of my career, and it made it all worth it. So I think it really depends on you as a person. I'm sure if you just focused on studying, like, it would be very doable. But I think with how competitive the landscape is, it is very good to kind of get a different level of experience, especially because UB has so much to offer. So personally, I didn't think pharmacy school was easy.
I have to ask you, would you want your healthcare provider, your pharmacist, your clinician, your people leading research programs to go to an easy program, or would you want to be challenged? Like, I personally would want someone who is challenged and has shown that they can get through that challenging program, because in the end, not everyone's going to be the same going in or coming out, but you want to know that you have someone who can think critically and provide you with the advice and support you need as a patient.
Francina, can you also talk about, we had a question that says, any advice for an early assurance student starting this fall?
Yeah, so I think, I'm trying to think, I don't know if the degree requirements have changed over the years, or the GPA cutoffs or any of that, from when I did it. But I think I also went into undergrad, I wanted to have like the college experience and kind of also, be part of my program. So at the end of the day, I think I went with the same approach. I like made sure I kept the grades needed for early assurance, but I also made sure that I didn't overwhelm myself with like classes, trying to like really finish it over the summer, winter, and all of that. And I think that's how I kind of early on, because it's like really challenging to transition from like high school courses into college level courses. I think the pace of learning is very different, and it's also a lot more like you have to do self-study a little bit more, kind of be a little more independent doing that, because in high school it was more like, teachers were really there to like help you, but in college you have to be a little more independent. So I think just kind of like stay on top of things, but also like realize you're in college and have the college experience.
Okay, let's see. I think I answered the question about the interview process for early assurance students. Early assurance students are interviewed in the spring of their freshman year. Early assurance students do very well in their interview. Dr. Shephard's one of our interviewers as well. Again, we do quite a bit of preparation. Our students all of our candidates do very well. They're very well prepared. They're excellent students by the time they get to the interview stage. And by the time a student is invited to an interview, in any situation, most schools want to admit students. That's why it's called the admissions process. So students should really feel proud of their accomplishments and their achievements if they've made it that far in the process. A student typically has done the due diligence of doing their research and their homework, as has the school. So it's really an opportunity for the student to get to know a school and a program. So chances are, at that point, whether it's an early assurance student or a PharmD student or a PhD student interviewing, they're probably, have prepared themselves pretty well at this point. There's a lot of help out there, and we provide a lot of help. We saw another question, one from a question for Vanessa about talking about the PhD program being demanding, maybe the first year. If you can tell us, if you remember how that went.
Oh yeah, I sure remember.
I do too.
I think it's the first 2 years that you have full-time classes, and at the same time you're expected to rotate several labs in order to choose the topic of your dissertation. And well, you have to work well with whoever advisor you think you will be staying. So there's a lot at stake. You will be investing some time already in the lab. There has to be like decent chemistry between you and the advisor, because I've seen a lot of people changing labs, and that does take a year or two for early graduation. So that has a toll. But it is demanding in the sense that you are expected several things: classes, succeeding classes, prelims, which are the preliminary exams, and starting rotation and doing lab work. But it's a lot of fun. I mean, you're determined to pursue your goals, right?
We have a question from one of our students about what experience at UB led you to choose a pharmaceutical industry fellowship over a residency. Francina, and after that, we have a question. Brian, I didn't miss your question. There's another question in the chat that we'll get to right after that.
I guess I could start since it was just last year. I think for me, I think I came into pharmacy school knowing I wanted to actually pursue a residency. The more I kind of opened myself to, opportunities and rotations, I think I was just like starting to explore ideas, and just because I think when you're in school, sometimes like retrospectively looking back now, I can say like, oh, I could have done this, this, and this. But I think when you're in school, stuck in the middle of that stress of like just passing your test, or like just you have a test today, but a test tomorrow, it gets very hard to be objective and kind of like think about the bigger picture. So I think the shift really happened like towards the end of my third year and like starting my fourth year on rotations. I think when I did my rotations and kind of saw, so I also did some out-of-state rotations. I was able to see how pharmacists interacted differently in different fields. And I think just based on what I wanted in terms of a career and the things I was good at, I decided I wanted to pursue something in the pharmaceutical industry as opposed to a residency or retail work. But I think that's just the path like I was interested in.
Thank you. Oh, go ahead. Nope.
I had a different, so I kind of fell into a fellowship. I was on the residency path, and I wasn't aware of fellowship. I don't think it had the prominence years ago that it does now, particularly depending on the school. There was a lot of representation from a few schools in the Rutgers program. And there still tends to be some concentration, but it's really spread out a lot more now than it used to be. And I can tell you, I've been interviewing candidates now for 7 years, and I think I can name every pharmacy school in the country at this point and where they are. But so I was not as aware of fellowship opportunities, and it could have just been me. It could have just been I wasn't focused on it. I don't know. But something I've tried to do since graduating is, first of all, help improve the awareness. I used to work more on the awareness side when I was a fellow, and now I work more on the mentorship side. So any students who are interested in pursuing that path, what is it, Dean's Alumni Ambassador. I think I have 4 students right now who I work with, one who I've been working with now for 2 years. And there's really a lot of opportunity in that area. And it was just different to me. I didn't know what I wanted to do. I never really found what inspired me. I wanted to help people. I didn't know how. I didn't know how I wanted to apply it. I knew through the evaluation process, I didn't want to be a physician. I didn't want to be a dentist. I didn't end up pursuing a PhD. And I had enrolled in one. And I ultimately found pharmacy, and I think I pushed it away because my father's a pharmacist and my grandfather was a pharmacist. So I pushed back at it, but ultimately fell into it. And you actually learn a lot of the skills that are overlap with a PhD and an MD, and everyone's unique, but there's a lot of overlap in the sciences that are all applicable to fellowship and industry.
Alex, I think you just answered part of maybe Brian's question, which was how you each discovered your passion for pharmacy and pharmaceutical sciences. So maybe Francina and Vanessa, just a quick additional comment, maybe, one particular thing that, allowed you to, that, you knew this was for you in terms of finding your passion for the fields.
I would say that UB would give me the tools I need to pursue what I wanted to pursue. But in terms of where do you want to go, where you feel you're headed. I think it's something that you probably should ask yourself. And now, if you decide to go to UB, you would know that you're well equipped, and not only on classes and expertise, but also the critical thinking that Alex mentioned, and like your personality will get modeled a little bit because of the environment. But where do you want to go? I think that falls more into a personal goal. I would say, I don't know about you guys, what you think.
Okay. I see, we're just gonna, our panelists, I'm sure have stuff to do, families and dinner and things to tend to. So I will answer. I see one more question that we didn't get to. I will answer it quickly, and then we're going to wrap it up, although I will stay on to answer any questions at this point. The final question that I think we didn't get to was, what was the acceptance rate for early assurance students to be admitted into the PharmD program? We get this question all the time. High level, the way that the early assurance program has always worked, and I've been in the school since 2007, each year we get a number of early assurance students that the university accepts. So we don't accept the early assurance students into the university as freshmen, the university does, and then a certain number enroll. So in the previous couple of years, we've had like around 150 students enroll as early assurance freshmen. The way that those numbers roll out, so it is a 2+4 program. So when you start as a freshman, like Francina did, you start in the PharmD program 2 years later. You start with 150, okay? Right off the bat, a whole bunch of students, when mom and dad and relatives leave after, in normal times they leave you at the university, you go and change your major. Freshmen and sophomores change their major 2 or 3 times, about 80% of the time. So we see a whole bunch of students changing their major at a pharmacy. We see students coming in, and then they come in and out and in and out. In the end, we have students persist through the program. Typically, we come down to about 100 by the time students change their major. When we start in the PharmD class, our early assurance class is typically somewhere between 70 and 80, 75 and 85 students in our P1 class, if that's sort of how those numbers work. So it's not percentages, it's just sort of how the numbers work. Those are often how students are self-selecting. So it's not a matter of can they do it, it's whether they want to do it and how they persist in the program. Many of our students go to medical school, they go to dental school, they become speech pathologists, they go on to PhDs, they become art history majors. So we have students that do all kinds of different things. I hope that helps. But again, every year is a little bit different. So we are going to, I will stay on, but I want to thank our panelists again, and I want to thank our moderator, Becky Brierly, my colleague. We work very closely together. Thank you so much for all your work with this. Thank you, Alex, Vanessa, and Francina. It's been great to see you and spend some time with you. Such a delight. Again, total privilege. This was a recording. We're going to put it up on our website. We'll have it available. I, again, will stay on and answer questions for everybody. So if there are no more questions for our panelists, you all are all free to head out, but certainly I will mute. Go ahead.
Jennifer, I'm getting a private message here from Prince Andy, and he wants, I think he has applied to the pharmaceutical program, and he's a little worried that he hasn't gotten news, but I can't really help him.
I understand. I will speak with him and talk with him after. Thank you so much.
Thank you for having me.
Yep, my pleasure. Thank you.
Thank you, everybody.
Thank you. Take care.
Thank you.
Okay, let's see. Just want to make sure I have everybody. Hold on. If you still have questions and you're still here, if you want to show yourself, I'm happy to answer any other questions. Paige, if we got all your questions answered. Let's see. Well,
I
good.
just
Did you
wanted
get
to
it?
say thank you.
Oh, my pleasure. Sorry,
You
it's
answered
so
all my
hard to chat
questions.
on the side. Yeah, no, my pleasure. So we have, undergrad classes, obviously a little bit bigger. Pharmacy classes are always taught in a cohort. So whatever our first year Pharm B class is, it's typical this year, it's going to be about 100. You're all taught together unless you break down into some smaller lab sessions. Freshmen are taught, biology, chemistry, math, physics. They can range, in terms of size and things like that.
Actually, I do have one more question.
Sure.
As for like research, like working with the professors and stuff, is that pretty easy to come upon?
Yeah.
And do like professors come and talk to you to like in a class setting to tell everyone about their research, and then you can kind of pick and choose? How does that work?
It's a great question. So if you're thinking of asking that at the undergrad level, do you mean in the pharmacy school? Pharmacy
Yes,
school.
I'm currently
Yes.
an undergrad. I'm going to be graduating next spring.
Okay, got it. I thought your name looked familiar, so you know some of this. Okay, so in pharmacy school, it's it's like a combination of everything. If you have no interest in research whatsoever, you can kind of move your way through the program and totally ignore it altogether in the nicest possible way. On the opposite end, you can do research like at every turn. So you can get involved in research as a P1. Some of it really has to do with you being self-motivated. It's as easy as after students are admitted, looking at our faculty list, we're a small school, and seeing, okay, Dr. Prescott does pediatrics. I want to do that. Email him. Do you have any projects? Yes, come in. It's that easy. We will provide so many different opportunities for us to share research with you. So we will, talk with you about